19-year-old Renuka Podal is expecting her first child. At this clinic, run by Family Planning Association of Nepal, while receiving antenatal care, she is also provided with HIV services. This integrated approach links different types of SRH and HIV services by physically locating them in one place or through a system of referrals. Linkages between sexual and reproductive health and HIV/AIDS have acquired priority over the last few years. Bi-directional linkages integrate HIV issues into ongoing SRH programs and SRH issues into HIV programs. Increased people's access to information and services, better understanding and protection of individuals' rights, improved quality of care, greater support for dual protection, enhanced program effectiveness and efficiency. These initiatives would boost SRH on the one hand and help contain the AIDS epidemic on the other. International Planned Parenthood Federation South Asia region has been advocating for linking SRH/HIV since January 2011.
Globally, IPPF is the leading service provider on sexual and reproductive health services and HIV services in an integrated manner under one roof. We do believe that bi-directional synergies, integration between sexual and reproductive health and HIV in government health systems are critical to improved access. We have been advocating for policy changes by adopting different strategies in the 8 countries through this project, by engaging with civil society, building their capacities and ensuring that these are integrated in the government health systems.
The benefits arising out of these integrations are high, as evidence from the ground in different national and local contexts suggest. At this FPA-run clinic, this 33-year-old mother of 3 children living with HIV gets counseling, treatment and care for HIV. Besides, she is also screened for cervical cancer.
My husband was HIV positive and I got to know about his status only after his death 7 years ago. I've come here to get cervical cancer screening.
Change is beginning to make itself felt as integrated services become the most powerful option available.
When we will prepare all these, one training manual, one service delivery point, one service provider and the one service seeker. This will take some time, but definitely we are moving ahead and we can get success very soon.
With a small grant from IPPF, 2 Nepal-based civil society organizations, Youth Vision and SPARSH, are now providing integrated HIV/SRH services to IDUs as well as to people living with HIV. From the Himalayan Kingdom of Nepal to the island nation of the Republic of Maldives, sensitizing key stakeholders, country coordinating mechanisms of Global Fund, governments and civil society organizations on linking SRH/HIV has meant incorporation of local expertise into integration efforts. In Maldives, UN agencies and the government have collaborated to produce the National Strategic Plans for HIV and TB. At its launch, Minister of Health Colonel Mohammad Nazim also emphasized the linkages between SRH and HIV. Access to communities living in its 2,000 islands is in itself a challenge.
Greatest challenge that we face in delivering any type of service, it has to be very widespread and we need a lot of human resource and lot of financial assistance in delivering anything to the island level.
Health workers reach out to these islands using speedboats like this one we took to reach the island of Naifru, some 142 kilometers from Malé. With a small population, of only 5,000 people. Gazing at the calm waters, Hamid Rashid, an inhabitant of Naifru Islands, introspects on his rather rough life. He took to drugs in 2001 while serving a jail sentence. Today, he is a transformed man. He has even gone through a rehabilitation and has been given information on HIV. A large, densely populated and culturally diverse country like India poses fresh sets of questions to what could be a suitable model of integration.
Government realizes that both these diseases have to have a holistic and comprehensive approach to achieve optimum results, and that is why we have been striving to achieve convergence at the policy level, at the field level, at the service delivery level.
The Government of India's flagship STI control program now incorporates HIV testing, abortion and ANC screening, expanding its scope and value.
We are already developed the Suraksha clinic. In NSC, we are at this moment, we are at 1,120 Suraksha clinic in entire country, which is at the medical college level and district hospital level. And we are providing the services to this through this Suraksha clinic, reproductive and sexual health and services.
In Bihar, expecting and nursing mothers are counselled on issues of maternal and child health care, contraceptives and HIV. Grassroots involvement holds the key to the success of SRH HIV integration.
We were able to refer the pregnant women for HIV testing and even their spouses. And initially it was very difficult since the committee were not able to ready to think or to get done their HIV test.
Down south, stigma and discrimination makes the plight of PLHIVs worse. A guiding principle of providing integrated services is acknowledging the rights of key populations. 37-year-old Selvi was denied treatment for cervical cancer due to her HIV positive status. Dindigul District HIV Positive Society, a network formed by, of and for people living with HIV/AIDS, took up the matter with the authorities. Now, Selvi receives ART treatment and counselling and is leading a normal life.
I was in bed for 1 month and no services were provided to me. With the intervention of DDS, I was given a referral and finally got my uterus removal operation done.
At its Mumbai branch, FPA of India is providing integrated SRH HIV services since 2002. They started with ANC clients in early 2000 and now provide integrated services to key populations. In neighbouring Sri Lanka, policy preference is geared to adopting an integrated approach to SRH HIV.
There are particular most at-risk populations. Now we are more address them with the other non-governmental organization. We have to bring them to our services. Usually with the non-governmental organizations are giving good support for the bring them up to it under the global fund.
In Matara district of the southern province, civil society organizations have been tapping the media to reach out to rural communities. With a small grant from an IPPF-SAR project at the Family Planning Association of Sri Lanka, Pratibha Media Network, a group of 50-odd people, have been sensitizing young people on diverse topics related to health, development, including SRH issues, spreading this information to their villages.
Young people in this training institute have been taught how to use blogs, so they know how to share their stories and experiences online.
Similarly, in Gaul district, Development Education Institute for Human and Environmental Resource Management has created a network that brings youth and teens together to create awareness on SRH HIV linkages. Other country experiences are equally encouraging.
FHA Iran started integration program 3 years back with capacity building initiatives of civil societies. We engaged with media, women leaders, and oriented them on importance and benefits of integration.
What we've tried to do with this program is try to get evidence-based research on what has been happening as a practice in many of the many levels, and what was also not happening, to be able to provide more effective services.
The way our transgender organizations and our transgenders as individuals who got enrolled in this project, they have now become very, very strong advocates for the integrated model. They are the ones who are going to keep this campaign on, whether the project is there or not.
After 2015, our main target will be to convince the government so that government includes this HIV/AIDS program along with all programs.
These stories of change are a testimony of the success of the integrated model that IPPF has put forward.
Advocacy on SRH HIV integration is a long-term process. This is just the beginning. We need to expand our learnings and continue to ensure integration so that we are able to ensure long-term sustainability and bring about comprehensive policy changes.
Making the world wake up to the potential of an integrated approach to SRH HIV is as much of an achievement for IPPF-SAR as the satisfaction that comes from knowing that we are inching closer to making sexual and reproductive health and rights a reality for all.